Great to be with you today. I'm in the press theater of the Legislative Assembly in the traditional territory of the Songhees and Esquimalt First Nations. I want to start by acknowledging the news today from the coroner's office of a record month of opioid deaths here in British Columbia. 175 people have left us. Those are our sons, our daughters, our fathers, our mothers, our brothers, our sisters. This is the wrong direction to be heading when it comes to addressing the public health crisis that we inherited when we were sworn into government 3 years ago this Saturday. We've been doing everything we can to address this issue, but during the pandemic, the drug supply has been drying up because of closed borders, and that means that the poison drug supply has intensified. I want to lift my hands to those frontline workers, paramedics, firefighters, those in emergency rooms that are doing everything they can to keep people well, to keep people safe during a pandemic, and also addressing an opioid crisis. I also want to talk today about the announcement from the federal government of the Canada Safe Restart Plan. The Safe Restart Plan has been in the works for many, many months now. I've been an active participant in discussions. I think we've had 20 separate discussions about how we could work together. Political stripes, all different, Liberal, New Democrat, Conservative, different regions, different sizes of communities, whether it's be Nunavut and the Northwest Territories with massive geographic areas and small populations, or densely populated areas like the Lower Mainland, Metro Toronto, and Montreal. And throughout those discussions, we've had a common purpose as premiers and as leaders of the federal government. The Prime Minister and the Deputy Prime Minister have been at the table every week having those discussions. My first call today was at 6 o'clock in the morning to finalize the details. And I'm particularly proud of our ability here in British Columbia to push the rest of the country to embrace the idea of a paid sick leave program, nationally funded and nationally coordinated. The Prime Minister and Deputy Prime Minister Freeland were early adherents to the idea, and working with them and working with Premier Sandy Silver from Yukon and Brian Pallister from Manitoba, we've been able to get that one across the line. That's $1.1 billion to make sure that people don't go to work sick. Dr. Henry made it pretty clear to me early on in the pandemic that the biggest challenge we had in the restart was making sure that people didn't go to work when they had potential symptoms that could lead to transmission to other workers or customers in the economy. So I'm very proud of that. I'm also proud that we've been able to work on issues around vulnerable populations. There's an increase in funding for mental health issues. There's an increase in funding for childcare. There's an increase in funding for vulnerable populations, people with disabilities, and more to come in that regard. This funding is critically important for people, and it's an opportunity for us to take the programs that we've already got in place here in British Columbia and enhance them with federal dollars. Another area of critical importance, of course, to our economy is public transit. We've seen a drastic decline in ridership, but over the past number of weeks, as we've moved from phase 2 to phase 3 of our restart, we've seen an increased use in transit. But the fare box has been hit hard. Revenues for BC Transit, revenues for TransLink have fallen off a cliff. And having the support of the federal government as 50-50 partners as we rebuild ridership and work with municipal partners is critically important. Similarly, municipal governments have seen a decline in their revenues, which means it's going to be a challenge to keep the recreation centres open, to take care of various other issues that municipal governments take care of right across BC. Again, a 50-50 cost-shared program with the federal government is the best way forward, and I'm very pleased that the federal government understands and recognizes that the best way for them to have a positive impact on people's lives is to partner with other orders of government, whether it be the provincial government or municipalities across British Columbia. We still have a lot of challenges ahead. Minister James released our financial updates. I'm very proud that BC is the first province to lay out clearly and transparently where we are at this point in the pandemic, and the number was staggering. Minister James will be doing everything she can to manage that as the year goes by. Certainly the resources that we receive today from the federal government for PPE, for other initiatives will amount to about $2.2 billion. We're going to be able to drive that into meeting our costs and providing services for people in the days and weeks and months ahead. Lastly, I want to touch on two issues that I would have focused on more today had it not been for the coroner's report about the tragic deaths of British Columbians, and also the good news about the Canada Safe Restart Plan. And that is two significant issues that have taken place here in British Columbia that have gone relatively unnoticed. Firstly, you'll recall two horrific fire seasons in 2017 and 2018 that devastated our public forests and put us behind the eight ball when it comes to tree planting and silviculture and getting our forests back to a healthy place. As we go into the tree planting year in 2020, we're hit with a global pandemic. That created fear in communities about workers coming from across Canada and across British Columbia to small, rural, and remote communities to start that tree planting process. So we worked with the public health officers, we worked with communities, we worked with contractors who provide the services and put the workers in place to plant trees. And as we come to just about the end of the tree planting season, we have almost planted 300 million trees in British Columbia without one case of COVID-19, without any negative impacts in communities right across the province, but particularly in the interior. The second issue I want to highlight is how we've managed our food supply and how we've worked with the agricultural sector and temporary foreign workers who have been historically the backbone of our agricultural worker community during previous summers and previous growing seasons. This year, of course, temporary foreign workers are at a premium because of COVID-19. What British Columbia did, and separate from all other provinces in the country, is we put in place a program where we would interview and screen temporary foreign workers as they came into British Columbia, and if they exhibited any signs of illness, they were immediately quarantined. In doing so, we prevented 28 infected individuals from going to farms and communities around British Columbia and spreading that infection. It's that type of measure, again, championed by Dr. Henry and Minister Dix, that leads the country. British Columbia has led the way in so many areas, and I know after we've come to the conclusion on the Safe Restart with Canada, we'll continue to lead the country. And I want to put the federal government on notice in a very positive way that I will continue to support the call from the National Police Chiefs last week that we decriminalize personal use of opioids, so we take away the criminal stigma and focus on what this really is, a healthcare crisis. We don't want people to be criminals, we want them to be patients, and we want them to get well. And I know the federal government agrees with me on that. Now is the time to focus on that issue, and I am very excited about taking the lead at the National Police Chiefs Organization and other community leaders across British Columbia and indeed across the country in making sure that we can collaborate on that issue as well as we've collaborated on COVID-19. And with that, I'm happy to take any questions you may have.